Finally tonight, for the past year, many Western New Yorkers have not been able to cross the border into Canada, with a few exceptions, of course. But it doesn't look like the majority of us will be able to head across the bridge anytime soon.
Yeah, Ontario has just declared a new 1-month stay-at-home order as the province battles a new surge of cases and lags behind in vaccinations. Now, as of today, 35% of New Yorkers have had at least one dose of a COVID vaccine.
But compare that 35% in New York to just 17% of people in Ontario who currently have received at least one dose of a vaccine. And joining us live to talk more about what is going on north of the border is Dr. Omar Khan. He is an assistant professor at the Institute of Biomedical Engineering at the University of Toronto. And Doctor, we're glad to have you with us tonight. And, you know, it seems like early on in the pandemic, the border was closed more to protect Canada from the higher infection rates here in the U.S., but now that's kind of flipped a little bit. Tell us what's going on in the Greater Toronto area and throughout Ontario in terms of cases and what's happening with the lockdown, and what's it going to mean ultimately?
I think let's start with the ultimately. It does mean that the borders will likely stay closed for a bit longer until this gets resolved. And really, the start of this is really vaccine supply challenge with not as much vaccine supply in Canada. Number of reasons, including no domestic manufacturing here yet. We've had to work on distributing our vaccines to what were the most vulnerable populations. And early clinical data said that that would be older people with comorbidities. So that's where the focus was. And since then, that's gone well. And now the age bracket is lowering. And again, we're focusing on people who are at risk, so also younger people with comorbidities. And that's what this new rollout and this new phase that we're in right now, in conjunction with the lockdown, is supposed to help with. So again, it's not going to be an issue if we had unlimited vaccine supply, but because there's a limit, the dosing and the way it's distributed has changed. And that's unfortunately meant that we are seeing a surge in these cases.
Yeah, many of us look to the vaccines as the way that we really end this pandemic and get back to normal ultimately. It has been a real challenge there. Obviously, as you just said, Ontario, we just looked at the numbers, has administered 2.8 million doses as of today compared to 7 million in New York State. We're about a third bigger, so you can tell those numbers are obviously lopsided. I wonder if you anticipate that things are going to start improving there. You mentioned that there's no domestic manufacturing yet, so I imagine that you're getting doses from Pfizer and Moderna facilities here in the United States. Is that going to start happening soon, and how long until you think things may pick up?
Well, the shipments from places like Moderna and Pfizer, as well as J&J, are ramping up this month and will continue to increase. And we've seen now that we do have more doses this past week alone, and now the work is making more people eligible for it. And in terms of domestic manufacturing, there are some companies here in Canada that are doing their late-stage clinical trials, but that's still early days. And in terms of domestic manufacturing, new investments being done, but it won't necessarily be ready for this pandemic or even this wave. So that will be time, and it's more of a future thing. But for now, we're continuing to work on making sure that this supply chain is secure.
And looking more into the future, Dr. Khan, finally, we like to think that there is a close relationship between our two cities and our two countries, and we just miss you. What do you think it's going to take as far as vaccination or percent positive rates before the Canadian and U.S. governments will reopen the border?
Well, let's just make it clear that everybody needs to do this reopening safely, and the last thing we want is to have anything come on either direction, right? So this is all going to be data driven. So what they'll look at is the rate of infection and how far it's under control, as well as the number of people that can be safely vaccinated. Then we're also tracking our domestic travelers to see how they are moving and if there's any coronavirus coming with them, and that will obviously mean that we'll be looking at international travelers too. So it'll come down to testing. So as soon as we see that the rates of new infections are going down and that things are back under control, things should look up.
Such great insight. Dr. Omar Khan is an assistant professor at the University of Toronto's Institute for Biomedical Engineering. Thanks so much for sharing part of your Thursday evening with us. We really do look forward to visiting Toronto as soon as we can, and I know you look forward to coming here to Western New York, right?
Definitely. Got to see my family.
Thank you so much.
And thanks everybody for watching. Remember, you can keep texting us your questions, your comments. Michael loves a phone number. Here's the one, 716-849-2200.